So there are several paths that I think could be further explored to improve this kind of functionality. One of them is to improve measures to improve the current adoption in today's electronic health record systems. The other path is innovations on top of this standards-based ecosystem that has been created and now is basically in place. This ecosystem includes EHR, a wide adoption of EHR systems, which is about over 90% of hospitals in the US. These are certified EHR systems that provide infobutton functionality compliant with the infobutton standard, which is required for EHR certification. It also includes a wide adoption and availability of online resources that are, clinicians are using in their daily routine and are also compliant with the HL7 infobutton standard. So there's a happy path in terms of, these things are available. People are already paying for these products. And part of the challenge now is turning the functionality on, customizing for each healthcare organization. And there needs to be efforts from that I think biomedical informatics and also medical librarians can have a lot to contribute to help with that implementation and customization effort at each healthcare organization. The other areas are more in terms of innovation. This ecosystem provides a lot, the capability to come up with a lot more functionalities or different ways of integrating online resources with EHR systems. Most implementations today are based on the idea of the I button or something similar to that. So a clinician or a patient would click on the I button and that would invoke the infobutton functionality. However, the infobutton standard and several online resources allow other kinds of interaction. So for example, you could have a little card that gets displayed on the EHR screen with some evidence that gets pushed to the EHR as opposed to the clinician having to click and find out what's available out there. We have been doing a lot of work also on domain-specific infobuttons, especially in the areas of pediatrics for children with special healthcare needs. We're working with the ClinGen project, which includes access to genetic information that clinicians can use to integrate genetics into their decision-making process. We're also working on a project with the CDC to leverage infobuttons for things like disease outbreaks and other public health emergencies. Another area for potential innovation is to improve the way online resources present information. So right now, the infobutton function, typical infobutton approach, automates the search process. It anticipates the questions that clinicians may have, and they just run the search. So that part, we have shown that there's time savings on that part of the search process. But once they land in an online resource, the experience is essentially the same as if they would search manually. They still have to, most often, have to go through several documents. They have sometimes to scroll down several pages within a document that might have 20 pages. And the answer to the question they have might be in one sentence or one paragraph. A lot of the content in a typical document may not be relevant to their patient or to their question. So future applications could, for example, automatically mine the information in an online resource and try to figure out what is the paragraph, what is the sentence, and how can that information can be summarized and presented to the clinician so that this last mile of information seeking can be more efficient. So those are areas that I think could benefit from further research and development, and that could be led by informatics.